Hi everyone, welcome back to my channel. If this is your first time here, my name is Lillian. I work as a registered nurse here in the UK, and you're so welcome. It's lovely to have you here. So as I told you in my previous videos, I work in the community setting and not in a hospital setting or the bedside. So most people wanted to know what we do in the community, so I brought my bag to show you what I have. So the first thing we do when we go to patients is check their daily clinical observation. So important. These vital signs, vital clinical observation are very, very important to determine the health of the patient. So in this little bag I have obviously the blood pressure monitoring machine. I have a cuff. This cuff is really good because it's adjustable. You can check on you can adjust it to bigger arm or smaller to get the accurate blood pressure. Okay, and then we have the oximeter, very important to check the oxygen level of a patient. And then we have thermometer to check temperature, obviously. So these we always have to bring it with us. So another thing we check in the community is the blood glucose level. We monitor blood glucose level. So we bring our glucometer, which contains the glucometer machine, and then you check the blood glucose level. If it's high, the blue one is to check the glucose. If the sugar, the glucose is high, you check for ketones. Obviously we use the lancet to prick the finger. That's so important. And then when we're checking the glucose, you need to check if the patient is on insulin. Are they complying? Are they on oral medication? Another thing we check a lot in the community is the suspected UTI. So what we do, we go with we have sterile bottles where we give the patient, and then they give us a sample, urine sample, and then we do a dip stick. So these are dipstick sticks where we check the urine, and if it's positive, we liaise with the doctors, then they prescribe antibiotics. And so that's how we bring the hospital at home instead of the patient going all the way to hospital because they have a UTI. We can treat it at home. So another thing, when we go to patient, we assess the skin. Very important, because most of our patients are elderly, so maybe they've got reduced mobility. They're always seated or lying on bed. So we check for skin. Pressure ulcer is a big issue. So we have a dressing pack here. This dressing pack is for wound care. So it has the PPE in there. It's got the gloves, the apron, the plastic bag. So we check that as well. Another thing we do here in our team as a community is blood test. So you have to have venipuncture skills. We check for blood tests. We take a lot of blood, so we check full blood count, UNEs, LFT, TFTs, and so we use, I'll show you. So we've got the needles, butterfly needles, very good ones to drain the blood. So we do that. What else we do? We do a lot of blocked catheters. Blocked catheters is another issue. So we always have catheters with us. If any patient in the community has a blocked catheter, you go and assess it. Or if it's bypassing is it's leaking. So we change it. We have different sizes. You have to check the size of the catheter. So we have size 12, 14, 16, 18, even 20. So we have to check that. Another item we always carry, all nurses or healthcare profession, is the stethoscope, where we listen to the chest to check, especially if patient has a chest infection or coughing, breathing problem. We check with the stethoscope, this chest, and we also listen to bowel movement. What else do we use the stethoscope for? Tell me in the comments. Okay, another thing we check is the urine retention. So we have a bladder scan where we bring it with us, where we scan for the bladder. If patient has a retention, we scan, and then we can insert the catheter to drain the urine, or just follow the doctor's advice. Okay, another thing we check is the ECG. Obviously, all nurses, they check ECG, where we check ECG is a machine where it's used to check the heart functioning, the heart rhythm, and the heartbeat. Okay, so here we have all the ECG things that we need. Okay, and what did I forget? I think that's it. We carry a lot of things in the communities because we really try to avoid hospital admission. So if you have any question, the next video I will explain to you the advantages of working in the community and the disadvantage, because as everything in life, there's always cons and pros. So before I forget, just to let you know, in my team where I work in the community, we work with other multidisciplinary teams. This includes physiotherapists, occupational therapists, speech and language therapists, doctors, LAS, this is London Ambulance Services, pharmacists, technical instructor, and all these teams, we have one main role: to keep patients comfortable in their own home and to make sure their care is taken care of. Please tell me what is in your bag, work bag. Doesn't matter where you work. Do you work in the office? What do you bring in your work bag? Do you work in corporate? What do you bring in your bag? And also, if you're a nurse or a healthcare professional, which setting do you work in? Do you work in hospital? Do you work with children? Do you work with mental health? Do you work with learning disability? Where do you work? Let me know. Thank you so much for watching. Please kindly don't forget to subscribe, share this video, and let me know what else do you want me to talk in my next video. Thank you guys. Bye.